My name is Kerstie Godwin, and today I'm going to be talking to you all about a community of immunity, which will be provided through vaccines. So, first let's talk about what immunity is. There are different types of immunity. We're going to be talking about adaptive. Adaptive can be acquired through an artificial style or a natural style. Naturally acquired immunity comes from the actual experience of the symptoms of disease, which can be life-threatening or detrimental to the future of your life. So artificially acquired immunity, which is provided through vaccines, involves the administration of antigens to the body, where your body will then produce antibodies without the experience of any symptoms of the disease. So antibodies are the proteins that your body will produce, which directly combat antigens, which are foreign invaders or infectious agents of the external world that will enter and cause disease. So, as the CDC states in their article, Why Are Childhood Vaccines So Important? They explain that through vaccination, children can evade the symptoms of disease. They can evade illness as their body is able to develop immunity without the detriments of illness. So vaccines are thoroughly regulated and they're safe. They have done numerous amounts of testing. The FDA performs most of this. And so the effectiveness of disease is seen largely in the minimization or eradication of disease. So the one disease that we have managed to completely wipe off the planet, except for laboratories, is smallpox, a disease that was once deadly to numerous populations. So as a future nurse and someone who has thoroughly researched this topic, I am hoping to convince y'all of the need for our world, the population as a whole, to continue the administration of vaccines and to make sure they're done in their completeness, as they will one day maybe free our future generations of disease as a whole. So, the things I plan to focus on are about how vaccines will specifically aid in disease eradication and the evidence that supports this. And then we'll talk about how vaccines protect not only the person receiving it, but the population surrounding them, including those who are immunocompromised. So, additionally, another great benefit of vaccines is that they reduce costs within our society, which Lord knows our economy needs it. So, to begin with, we're going to talk about how vaccines can help in the eradication of diseases. So, thanks to vaccinations, there have been many diseases that many of us may not even recognize. They've nearly been forgotten because they've been prevented so much. So when there have been outbreaks, however, there has been research conducted that directly links this to a population reducing the number of vaccines. So this is explained by the CDC, and the National Institute of Allergy and Infectious Disease also covers a case in 1989 in which there were 55,000 cases of the measles, and 136 of those resulted in death. And all of this with a disease that was greatly repressed occurred because people opted out of getting necessary vaccines. So of course, once they started getting their vaccines again, the outbreak resolved itself. And again, in 2013, there was another measles outbreak, and there was a direct link, once again, that the populations had reduced their numbers of vaccinations. So once the vaccinations were re-administered and brought back up to speed, the outbreak resolved. And sadly, this is a threat right at home in Texas, because Texas was one of the major communities affected by this 2013 outbreak. So another thing to consider when we're talking about disease eradication and control is the fact that travel. People are known to travel. We want to see the world, but other countries don't have the same medical developments that we do. They don't have the advances that we do. This isn't to say that they don't have access to it. It's just to say that they haven't made as much progression as we have. So, if we travel abroad and we're exposed to the measles, we're exposed to polio, whatever disease you can think of that is preventable by vaccine, and we are not vaccinated, we are a plane ride away from coming home and spreading an outbreak of disease to our community. In the CDC's article, Making the Vaccine Decision, it is explained that unvaccinated U.S. citizens who travel abroad can bring these diseases that are still evident in other countries, putting unvaccinated children among us at risk. And this is also evident in a 2011 case where 90% of the measles cases that were experienced in the United States were linked directly to some form of travel abroad, whether it be personal travel, contact with someone who traveled. Any form of travel can be the cause of an outbreak of disease. So, to satisfy our need for vaccinations to help in the control and prevention of disease, we have to consider that having seen the effects of 100%, where are we at? So 100% eradication of smallpox. There's no other diseases that have truly been eradicated from the earth. But with the evidence that the smallpox disease has been eradicated, it proves that this can be done with others. Therefore, we have to continue vaccinations, because while it may seem at a far reach to hope for eradication of other diseases, it is possible. So now that we've kind of discussed how vaccines aid in the prevention and reduction of immunity and even eradication, aid in the prevention of disease and improved immunity, we're going to discuss how immunity itself can protect not only you, but your community as a whole. And this is going to stem from what's called herd immunity or community immunity. So herd immunity is pretty much where everyone has immunity to diseases. Thus, if most people are vaccinated, the ones who are able to be vaccinated, medical conditions permitting, we serve as a community of immunity, protecting those who cannot receive vaccinations. So we not only protect ourselves, but we protect others. And it's inevitable that there's going to be populations in our world that can't receive vaccinations, or they're going to have weakened immune systems. These are seen in cancer patients. They're seen in people who receive organs. They're seen in newborn babies who are too young to receive some of the necessary vaccinations. So, to satisfy the need of protecting these individuals who don't have the necessary means to protect themselves with personal immunity, we need to do our part as their community to protect them. We need to get our vaccinations, strengthen our immunity, so that we can prevent them from coming into contact with any disease that could harm them for the rest of their life or even claim their life. learn that your vaccinations not only protect you, they protect your friends, your family, anyone you may come into contact with. So I'm going to try to paint a picture for you of what can happen if you opt out of vaccinations. And this story will kind of stem from the story quote or titled Meet Riley on page 27 of the CDC's Parents Guide to Childhood Immunizations. So let's imagine that we opt out of getting our vaccinations, and I'm going about my happy life, nothing's wrong, but I don't know that I'm carrying a disease. It's not affecting me, but I'm carrying it. And I come into contact with a little 8-year-old girl who had a heart transplant when she was 2. This 8-year-old girl gets this disease because she doesn't have the immunity to fight it off. She takes immunosuppressant drugs so that her body doesn't reject her heart, which is allowing her to survive. So my choice to not aid in the providing of immunity to my community, my selfish choice is going to cause this girl to have numerous doctor's visits, hospitalization possibly, and possibly suffer from damaging effects for the rest of her life, and it may possibly end up claiming her life. So while this is all hard on the little girl, we also have to consider her parents, family, friends. This is not only going to be tolling on them emotionally, but the cost of treatment. All of this is going to be ridiculous amounts that they could have avoided had I got my vaccinations. So, vaccines save money, save lives. This is another benefit of vaccines, in addition to helping prevent diseases and protect other weaker sectors of the population who don't have the strongest immunity. So everyone knows that all things medical are pretty much considered expensive, but we have to recognize that vaccines themselves, they may have a cost, but they overall help reduce the costs to our society. So the way this works is vaccines help us save money because if we can prevent disease rather than treat disease, it is a much cheaper route. There's not near as much tedious work that requires labor or expensive, rare, maybe medications. So also vaccines, as it's cheaper to prevent disease rather than treat disease, the factors of treatment that are going to cost you this vast amount of money are going to be the potential hospitalizations, the numerous doctor's visits, potential care that will be lifelong because this disease has stuck with you and damaged you permanently, or even at the worst case, death, which of course still requires cost for funeral services, burial, and so on. So, if we can prevent disease rather than go through all this treatment, we're going to save money for our society. Another way that vaccines can help us save money is if parents have a sick child, it's in human nature that they're going to want to be with their kid. They're going to want to be there comforting them. They're going to want to be there taking care of them. And this is going to interfere with their work. They're not going to be able to work and earn the funds that are going to provide the medical treatment that's necessary. Now, of course, disease isn't completely unavoidable. It's going to happen, but vaccines can help reduce the occurrences of this, and this can benefit our society as a whole. So, in vaccine benefits by the NIH, a 2005 study on the economic impact of routine childhood immunization in the United States, researchers estimated that for every dollar spent, the vaccination program saved more than $5 in direct costs and approximately $11 in additional costs to society. So, in other more simple words, for every dollar that went towards a vaccination, there were $5 in direct costs that were saved. There were $11 in additional costs that were saved. All of this benefiting our society. All of this saving money for our society. And many people claim, the people who have become anti-vaxxers, that part of the reason they avoid such things are because they are expensive. However, there are organizations and insurance that will aid in paying for these things, such as the Vaccines for Children program and insurance. These programs allow for covering most, if not all, of the costs of vaccines. Insurance agencies want you to be healthy, so they don't have to cover the costs of your illness, your injury, what have you. They encourage your immunity. So, to satisfy our need for the benefit of the society's economy, we need to encourage vaccinations, as they not only prevent disease, they not only protect the population as a whole, they will help our economy. They will give us a stronger economy. They will allow us to put our money towards more effective things. So to visualize how this can work, we must look at vaccines as though they're still, to this day, a breakthrough in medicine. Vaccines are still being researched, developed. There's changes happening all the time. And if we continue this research, it's not only going to save more lives, it's going to improve our society. It's going to make us a stronger population. So, now that we understand how vaccines help in preventing disease, how they help protect those who lack immunity, how they can improve our economy and allow us to put our money to other more valuable things that can be avoided, let's talk about what exactly the vaccines serve as for us. Vaccines are basically what I would like to consider soldiers that stand beside us. They walk with us, and they stand with us in the fight for immunity and survival of our population. They are the ones who provide us with the strength we need to not suffer the illnesses and even defeat the illnesses in their entirety, such as the eradication of smallpox. So, what I want to ask you to do as a population, as members of society, we have a moral obligation and a duty to advocate for our society's well-being, their health, their immunity. We need to strive for a community of immunity. So what I ask you to do is, if you see the value of vaccines protecting everyone, contact your lawmakers, lobbyists. Explain to them the necessity for law mandating that vaccines be necessary for everyone unless a medical condition interferes and prevents this. Raise awareness at a community event. If you see the opportunity, use it. Spread awareness of how vaccines are effective. Conduct fundraisers. You can conduct fundraisers to fund the research of vaccines. You can conduct fundraisers to aid the financially unstable so that they have no reason to not have these vaccines. There's no interference whatsoever of saying they cost too much. Let's help them attain immunity, because it not only benefits them or us, it will benefit the world. So with vaccinations, the way that vaccinations protect our entire planet, other reasons we need to fight are, think about the cancer patients, a 2-year-old cancer patient, an infant who is taking his first stroll out in public, a organ recipient who is taking immunosuppressant drugs to ensure the survival of their new organ. We need to protect those people. They've already struggled enough in life, and if we get our vaccinations and we produce a community-wide immunity, we can protect them. We can ensure that they don't encounter these diseases that will more than likely result in lifelong harm or death. We have the obligation to protect these members of our community. We need to fight for vaccinations to be continued in their completeness for our future generations. I want my grandchildren and my grandchildren's grandchildren to one day maybe see a world where a disease that's still evident today may be eradicated, such as smallpox. The vaccinations we receive today will benefit us not only now, but in the future. But we must continue this process. So, our moral obligation as a society, as compassionate human beings, as the beings that God made us, is to care for one another. And we can do that with vaccinations. Continue to strengthen immunity. Fight for the well-being of the world, because we can achieve eradication of disease. So, get your vaccinations. Fight for a community of immunity. Thank you.